doing a series called Bitcoin, Health, and Coffee, and we're doing it probably every 4 to 6 weeks. This is the second of the series. And so, what's happening in healthcare at the intersection of Bitcoin is actually quite a bit. We're seeing models like ours. It sounds, they just say, where we're bringing a traditional financial product and we're basically Bitcoinizing it. We're allowing people to hold Bitcoin in a triple tax advantage health savings account. That's never been done before. Dr. Mark Stephany is the founding president of the Bitcoin Physicians Network. This is a growing network of physicians that are probably doing a couple of different things. I'm going to let Mark explain what the organization is, but it's a growing consortium of physicians who have an interest or operating adjacent to Bitcoin, maybe holding Bitcoin on their balance sheet, accepting Bitcoin for payment, etc. But there's bigger things at work in terms of what Mark's going to talk about today as well. There's a few other things that are going on at the intersection of health and Bitcoin. Crowd Health is not a Bitcoin product, but they're allowing people who are members of their platform to hold Bitcoin in a separate, not a tax advantage account, but they are mindful of Bitcoin's long-term savings potential and are aligned with that. And so with that, Mark, if your mic is still working, I'm going to turn it over to you, and we'll get going. There'll probably be a lot of questions. There's a lot of tremendous Bitcoin horsepower in this room, so I'm sure it'll be a good discussion today. So thank you so much for joining us, Mark Stephany.
Yeah, thank you so much, everyone. I appreciate you being here on this early morning. I hope you have your coffee, and I wish I was there in person. I had a fantastic experience at Bitcoin Park earlier this year when I was there for the Sound HSA sponsored event on Bitcoin and health, and it was a fantastic experience. That event focused a lot on what we saw as problems with healthcare, and I'm hoping to take that conversation a little bit further and address some of the issues that we can do, some of the things that we can do to help change the system. And as Stu said, my name is Mark Stephany. I'm a hospital medicine physician here in Minnesota. I'm the president of the Bitcoin Physician Network, which, as Stu alluded to, is a 501c6, where our initial mission here is to really educate and advocate for Bitcoin and its use in the healthcare system, specifically through discussions with physicians. And the overall mission for BPN will go well beyond that, and that is to how, and we will discuss that here in this presentation, with the hope that we can build a parallel system to the current status quo. I am a physician. I am not a technical individual. And so I'm sure there's a lot of you in the audience who are, and I appreciate your feedback going forward as to how you may see some of these technologies that I discuss implemented into the healthcare space. So advance to the next slide here, Stu. To have this kind of conversation, we need to first ask the obvious. And is that, do we believe Bitcoin to be more than an asset simply to hold or trade? That is the prevailing sentiment amongst TradFi and mainstream media, but we obviously know that it is more than that. And so we have to ask ourselves, what does a finite, censorship-resistant, private, decentralized, monetary network offer healthcare? And we have to ensure that we don't fall into the 2017 blockchain looking for a problem scenario. This needs to be more than just putting medical records on the blockchain. And so that's what I'm really asking of you today is, how can these technologies actually improve the healthcare that we can offer? And so my central thesis trying to answer that question is that in order to have meaningful reform of healthcare, we need to build a parallel care economy, not one that changes the current insurance-centered system. That's very much a Jeff Boothyism, right? You can't change a system from within itself. We're going to have to build something alternative to that. And I think Bitcoin and other technologies like Nostr will serve that purpose. And so from a high-level perspective, what might that look like? It would look like patients contracting directly with physicians in their facilities for more clearly defined care. It's allowing AI agents to help coordinate options, compare services, manage payments, and coordinate next steps in a patient's care experience, as well as from the physician side. Certainly for the time being, I see physicians remaining responsible for final diagnoses, prescribing, procedures, emergencies, and trauma care. Overarching all of that will be open protocols that reduce the dependence on any single marketplace or software service, such as Epic or Cerner or any even siloed health systems. Next slide. And so approaching that, we can really look at this situation as two communities in one problem. On the physician and patient side of things, we can identify the problems with the status quo as time and attention being diverted away from ideal patient care toward authorizations, toward coding, toward the myriad bureaucratic rules that we have to deal with day to day. Obviously, price transparency is non-existent. And referrals, records, follow-ups, all of that are scattered across separate siloed systems. And so in order to help solve for that, we need to have more of a transportability of users' identities and services. On the other side, Bitcoiners have a very similar concern with the status quo of traditional financial services. There's closed networks that control your identity and payment and access to financial services. Intermediaries obviously can block or delay and capture value along the way. And users of those financial services cannot easily exit without losing their history or relationships tied to those financial networks. So we share really a common goal, and that is direct relationships, clear prices, portable private identities, and patient-physician control over that relationship. The next slide. It's, I think, important also to more clearly define what I mean by parallel. If we look on the patient side of things, that allows a patient to find, pair care outside of the restricted insurer-controlled modalities. And on the physician side, that allows us to work one-on-one with patients to agree on fees, predetermined pricing without intermediaries. I discussed that portability earlier. Records, permissions can all move without being isolated on specific software like Epic or Cerner or, again, siloed hospital systems. There will likely be integration of independent practices across these separate marketplaces that need to interoperate with each other without restrictions. And that's where some of these open protocols will be helpful.
Mark, can you hear us?
I sure can.
Wonderful. Who in here has had any experience in healthcare, like exposure to the healthcare system, U.S. healthcare system, as a patient, obviously?
Obviously, patient, why, sir.
So, I mean, Mark, all this kind of distills down to just the bloat that is in the system, and it is complex by design by all of these intermediaries that have created this $5.3 trillion spend that we have. And I think to everybody, the amount of money that we all spend either through premiums or out of pocket for healthcare, when there's not really a marketplace, there seems to be a lot of administrative waste, and the systems, the EMR systems, don't even talk to each other. In our world of interoperability and everything, healthcare is lagging grossly behind. And so EMRs and data standards were created as a part of the High-Tech Act coming out of Obamacare in 2008. And what it did was it capitalized health data, because Cerner and Epic and Allscripts and Athena and all of these systems said, well, we're going to go out and monetize this, because physicians were penalized if they did not get up to speed with electronic data records. There was a penalty schedule. If they didn't hit certain barriers by certain times and they were taking Medicare or Medicaid, they were going to have to pay massive fines. So they had to digitize, and companies said, we're going to come in and grab market share. So
you're probably the most behind on any AI tool right now.
Yeah. Sorry, Mark. I wanted to just add that in. Good
No, I
morning.
really appreciate the additional context. It's incredibly helpful. And if this is a good moment to pause and add for any clarifications, then certainly we can. Um, and I'll get to kind of a patient experience journey as to what this might look like and contrast that to the current status quo here momentarily. Um, Responsibilities in this new parallel system, I think, can be clearly delineated as well. Again, patients would control their access to their medical records. They can predefine permissions, preferences, and who has access to uh, their health history, as well as whom they can pay for that. On the other side of that relationship are the clinicians who, like I said, will still most likely for the time being provide that final diagnoses and prescriptions as well as procedures. But that care, I firmly believe, will be coordinated by agents in the near future, which will allow for uh, authorization of records from the patient side of things. It'll help explain options. It'll help coordinate payments as well as the care itself. And that entire ecosystem, I believe, could be built on platforms like Noster, which would allow for portable identity, signed messaging, and cross practice communication without, again, siloed software services. Payments could easily be handled through Lightning, which would be faster and cheaper for these independent practices. And of course, Bitcoin itself can provide some durable proof of work, so to speak, as well as a time stamping for authenticity function, and obviously more of a treasury escrow value and final settlement depending upon the size of any financial transaction. Next slide. I want to touch on Nostr a little bit more. Yeah.
Real quick, this is a great slide, the division of responsibilities, because I think everyone's asking what is Bitcoin's role as we start thinking about, payments, agentic A to A payments, even in healthcare and obviously other applications. This summary and kind of progression that you've laid out, I think, is really good. And I think it's something that the healthcare space, as we contemplate, layering in all this new technology, how's it all really going to work? Because people have talked about, using Lightning for agentic payment. I mean, who in here is on board with that or believes that that's possible? I think it's possible.
Yeah.
As opposed,
Possible is absolutely true.
yes.
The implementation and adoption is the trickier part. But possible, the technology can handle it.
Yeah. Is the payment a stable coin solution, or is it a Bitcoin Lightning solution, or both?
Both.
Absolutely. For adoption for multiple ideologies, I would say both.
Okay.
Yeah, and I would have to agree with that. And I think we'll find out, and there will be elements. I think the answer will reveal itself to us. And somebody brought up the good point as, this all comes down to adoption. And the overarching theme to this entire conversation is we have to provide a better service. We have to provide a better product for patients to want to engage in something like this. And I think that's certainly possible. And what I'll finish with here in the end. So I want to touch briefly on Noster, which, currently functions a bit as a parallel social media platform to X currently, but I think it really is more than that and will become more than that because it can serve as this transportable identity and communication tool that I think could be very effective as we build out this parallel system where somebody's identity can be private and interoperate between different systems, different independent practices, different services without having to be siloed, without having to go through a fax machine, without having to sign, a paper copy of a record request. You have your predetermined permissions to be able to do that for you. To answer the agent question, somebody more familiar with this in the audience may be able to speak to it further. But most recently here, I came across Open Agents, and specifically their Taciter project, which is using Bitcoin and Lightning to have AI agents pay each other for operations. And so it's easy to conceive how that could work in the healthcare system, allowing agents to pay for services uh, and any other thing that needs a fee associated with it without the uh, conscious decision from a human being. Obviously, those parameters would be set in advance. And so this is a specific protocol that is looking to do that very thing, not necessarily with healthcare right now, but they are building it with Lightning. Is anybody more familiar with this project than me?
Yeah, they're buying up a lot of compute. They're based in the Austin area. So Chris David is working on that project. I don't know specifically, but yeah, they're right now they're buying compute for Bitcoin right now, and then unlocking the agentic networks.
Yeah. So let's walk through a patient journey for this um, future possibility. Um, right now, I'm going to walk through kind of the status quo experience. Let's say you're a 45-year-old female. You start developing some nausea, right upper quadrant pain that's worse after eating, and you call your primary. Your primary says go to urgent care, but you don't really feel that it's that severe, and so you wait a few more days, maybe weeks, and it's still not getting better. And you you finally go to the urgent care, and they think that you have some gallbladder disease. That in turn, depending upon how bad you're feeling, they're either going to send you to the emergency room or give you a referral to a general surgery, which could take weeks, if not months longer to establish care. Meanwhile, you continue to suffer, be in pain, and not know what's going on. If you get sent to the ER, perhaps they deem that your symptoms are not severe enough, and they either send you home with a 5 to 6 figure bill, or you do get admitted and get addressed with that subsequent bill, all the while um, restricted to obviously where you can go for those evaluations, procedures, uh, and, and surgeries without knowing what any of it's going to cost. Zero transparency, zero ability to say who you want to be treated by and how. In this parallel system we've been discussing, that same individual could put in their symptoms into their agent. That agent, in turn, would already know their past medical history, prior lab results, medications, and in turn, be able to provide that individual with what we call a differential diagnosis of her symptoms. And again, pointing most likely to biliary disease of some sort. That in turn would cross communicate with the surgeon's agents, who would review that patient's symptoms, agree or disagree with them, and then offer their assessment with transparent pricing, which in turn the patient can address, review, and then establish uh, an in-person meeting, whether that's in their clinic or virtually. And that's something that could take place within minutes to hours, and certainly not the current status quo of days to weeks or months or longer. And payment, of course, could be seamless, as predetermined by the individual's set parameters for how much they want to pay, when, and whatever else that they arrange for on the surgical side of things. When we think about Bitcoin specifically in healthcare, I think it's important that we again address what it could be used for and potentially what it may not be used for. And we're talking about Bitcoin itself. And this provenance and time stamping function could be interesting for proving that a document exists and document integrity. Obviously, the payment side of things and escrow. But I think when we look at what it may not be used for, this 2017 idea of storing medical records, I still find that a challenging thing to want to put on a blockchain. Medical records should not be immutable, and they should be able to be edited. So when we talk about spam on the blockchain, I think it doesn't get much worse than medical records. But that's not to say that it's not a possibility. Bitcoin declaring a diagnosis to be true. We talk about Bitcoin as being a truth machine. I don't. I think that's taking it one step too far. I can prove that a diagnosis has occurred and when, but not whether it's accurate. One of the more interesting questions, and I believe he's in the audience, is credentialing in identity, and individuals working on Nas Fabrica may be able to tackle this question about whether or not the individual that you're interacting with on, say, platforms like Noster is in fact who they say they are, and are their credentials legitimate. This is an incredibly challenging problem, and one that I think it is solvable, and I hope that it is, because it would be an extra layer. It would be a needed layer for this entire process. And so I'm going to pause there to see if anybody want to speak to those elements.
Well, one thing that it just makes me think of reading your not for is just why real world assets don't work on a blockchain, because you need that real, like going from the physical to the digital, there has to be some authority that is kind of deeming this to be actually true, that it was put on in the correct way, and that it's enforced if there is any sort of disagreement. I guess I'm curious, as far as the licensure and credentialing, is that a big issue that like people are out there, pretending to be doctors, and the patient doesn't know?
Not from a no, that is within the United States a relatively rare situation. On the physician administrative side of things, it is a incredibly bureaucratic and archaic system to be credentialed, and it works. It is just expensive, cumbersome, and a pain for both physician and health systems alike. And so, if you can disintermediate that bureaucratic layer, it'd be tremendously advantageous to both physicians and patients, because right now, obviously, patients assume that the physicians that they're being treated by in a health system are credentialed, and that system does work well. It's just incredibly gated and doesn't lend itself to this type of system that we would want to see. Therefore, something different needs to be created to fix that problem.
Yeah.
Is anybody from Nas Fabrica in the audience?
Mark, not here in the room, no.
Okay. But Stu, you could speak to that.
Yeah, so Nos Fabrica is an effort that Dr. David Strayhorn, who is a GI doctor, I believe, Mark, if I'm not mistaken, but he's a Bitcoiner and has invested a lot of time and resources in creating Nos Fabrica, specifically a project called Web of Trust. My co-founder, John Gordon, also is a part of that. And Web of Trust is kind of like what we're talking about here. It's like, it's understanding, if you go to a specialist somewhere, they are who they say they are, but you also have a verified, trusted group of people around that have met the criteria to be included in that. So it sounds, from what I understand, I'm not involved in the project directly, but that there are permissions that are involved, but it's based on a consensus trust mechanism to say that physician is who he or she is, claims they are, and they have the qualifications to see you, to treat you, to operate on you. I think that captures a big chunk of it, Mark. What David's working on.
Yeah, absolutely. So the system does work as it's designed in the status quo, in that people who are not licensed do not get to practice. But it is obviously an incredibly bureaucratic system that does not lend itself to this type of parallel system that we want to build. And so, how do we do that? And this Web of Trust idea is trying to answer that.
So as you're looking at this, I think one of the key distinctions here is what's the key advantage of Bitcoin? Where does Bitcoin come into all of this? How does it fit? What's the unique advantage? And where does it make a difference? And where Bitcoin fits is it removes the requirement to deal with trusted intermediaries. That's the core value play for Bitcoin.
And holds value cost as well.
Yes, but partially why it holds that value is because you're not stuck trusting these intermediaries, that you can have the direct relationship and all of that. As you're talking about the healthcare system, I don't think this is true for a lot of people. I know for my kids it is not. But for me personally, I live in the Lehigh Valley in Pennsylvania.
Yeah.
There's a group called the Lehigh Valley Health Network. They run Epic, if I recall correctly.
Yes.
All of my records are there. And I had this happen recently, I need an expert referral. I go to somebody in the system, they have all my records, it all works, and there's no immediate pain point to me.
Right.
Because I trust them. And as long as I'm 100% confident that LVHN is a good actor, they're working well for me, there's no immediate pain, there's no desire for me. Well, there is because I'm a Bitcoiner, but there's no desire for me, like the regular person,
as a patient,
right, to want to make any change whatsoever from that standpoint. The areas of friction that I see and my frustration as a patient directly, not even from the Bitcoiner standpoint, is at one point I had to get some physical therapy. And I went to the physical therapy office and I went, hey, how much is this? And they look at me and go, oh, your copay is $50. I go, no, I understand that.
How much is it?
Well, how much is it really? Because at this point, there's a bunch of conversation in the healthcare network about healthcare is too expensive and like patients should be helping to control costs, not do stupid procedures.
Right.
So I was trying to do my part as a good citizen and say, well, how much is this? Is it really worth it to me to do that, even if I'm not directly paying the cost?
Right.
It is so opaque.
Yes.
Their office didn't know. They called their billing office in Ohio, and I actually pursued it for a bit. And after about a month of following up, trying to get a number out of them, I couldn't get anything.
Yeah.
It is horribly opaque.
Yeah.
So the area where I see for Bitcoin is, as a patient, if I want a direct relationship with a healthcare provider, having a no trusted intermediary blocking that relationship, that's kind of that area that it fits. So how do I know my doctor's a real doctor? Credentialing, something in that area.
Right.
How do I have a financial relationship with them? I can do like, how do I put that all together? How do I hold my records in a way that they can get access but no one else can? That's where I see a lot of this directionally.
Well, and having spent 20 years in the credit union industry, I can tell you from a real estate transaction.
Oh God, yes.
And I've gone to Congress. I actually asked to have it put in the Clarity Act bill because I think this is the biggest issue. Home ownership is a major barrier for most people. The cost alone, the recording process that these counties have. So could that actually be a real world application, a process to use for A to B transfers between just two people to know that, hey, you actually own the house. I'm comfortable moving with this transaction. This same concept applies to what Jesse just said from the medical side. Back to what Jesse said, in Philadelphia, we have in the University of Pennsylvania, Drexel, the list goes on with medical institutions. They all use Epic.
Yeah.
I will tell you, I personally dislike Epic.
Yeah.
My chart could not be any worse than that,
Yeah.
Well, I've got briefly with the Epic Network, but what's its fallacy?
The thing is that everybody knows everybody's business because even my family physician sold off the University of Pennsylvania, and now there's no everything I have medically for all my physicians is in one single point of failure.
So could we store those records in like some sort of master design, so therefore it's ours and they only get to view?
Well,
like you.
Yeah, so on the health data piece, so Sound HSA, we are a regulated health savings account that's Bitcoin native. But we also, before we launched that product, we launched another product called Move to Earn, and allowed people. In our case, we did global challenges to earn Bitcoin for steps, and we did it probably 3 or 4 times last year. And so that brought people into the ethos. Okay, there's an overlay here in terms of sound money and sound health. It's around fitness and finance, and wellness in our case. But what we have learned, and we've put it into practice, we have taken that step data through relays, and we have given our customers the opportunity to redact that step data and save it to Noster. Now, that's a small use case, step data. It's not a complex cardiac patient that's got mountains of tests. And certainly, you're never going to put images on the base layer of Bitcoin or on Noster. It's first of all, it's a public blockchain. Second of all, it's a mountain of data, and it just doesn't make sense. That Mark's talked about 2017. We in this town, we all got caught up as healthcare industry people in blockchain for health, and it was awful. We all were well intended. We just didn't really understand what we were talking about. Like blockchains.
It was early in the cycle.
It was very early.
It was worth exploring.
Yes.
Clearly, it's not the right answer.
And raising different technologies as well, making it all confusing to be able to have the conversation of what is it really in the first place.
Well, and back to the well-intentioned, everybody in this town, especially, there's 800 healthcare companies based in Nashville. It's the biggest healthcare market in the country. Okay, certainly on the hospital side, service side. I believe everyone's well-intentioned and they want to fix healthcare, but we don't have the tooling, and we have too many misaligned incentives to do that. It's not like people are inherently bad. It's just people have grown up in the bloat, and it's like, okay, how do we unwind this? Yeah, we provide some of the best medical care in this town, in the country, in the world, right? But it is, Mark, I don't know who the physician was on one of your panels back in April at the event we did here, but he said, the city of Houston is so proud that it has miles and miles of hospital concrete and campuses. And he was like, you shouldn't be proud that you've got acres of hospitals in your town. He goes, that signals that you're not healthy, that it's, you got a lot of sick care. And it was an interesting perspective. I didn't really thought of it from that standpoint, but
Yeah.
yeah, go ahead. I'm sorry.
No, I'm just gonna. We've kind of covered this next slide quite a bit here, so I'm gonna jump ahead just to the last slide so that we can open the conversation, because what we're really getting at here is the question of what does this new system look like? What would we want in a new healthcare system, and how would these technologies, in fact, allow for those alternatives to occur, or will they at all? And I think the answer to that question is that after this conversation is that we do believe that they have a place for it, but what are the exact problems that we want to change? And to your point, Stu, the best reform for healthcare is not needing it in the first place. And so that's where we as Bitcoiners, as layer 0 in this network, need to really be that impetus to push for low time preference, healthier choices, so that we don't need healthcare in the first place. But that when an individual does, we've built a system that is far and away a better experience than what they're going to get now. And I do believe that Nostr, Lightning, Bitcoin, AI agents can help create that. It's just going to need to be in a different system outside of the status quo that will not create itself. And we have to be responsible for building it. And I fully expect BPN to be a part of that. And I hope that all of you will be a part of that mission as well. And so I'll end there. And I really appreciate everybody's time. I hope that this lends itself to some ideas and better understanding of how Bitcoin can change things and how we as Bitcoiners can do that. So thank you, everybody. I really appreciate the opportunity.
Thanks, Mark.
I see a lot of parallels between this conversation and just somebody trying to understand Bitcoin in general, because somebody who's trying to understand Bitcoin is going to look at it as a technology and be like, all right, I can do it for cross-border payments, but I don't have somebody, who's cross-border that I need to send money to. And so like you're trying to have a technological solution. And yes, there are those use cases. And just like for this conversation, yeah, Lightning's going to make it great to be able to, quick, easy settlement with your physician. But what really helps people lock in and understand what Bitcoin is like you kind of alluded to, is the incentives and being able to have kind of look at the system as it is. Personally, as somebody who uses, or I had insurance before, to be able to, have no idea what the price is. Talking about transparency, but also the system as a whole is set up to treat sickness as opposed to prevent it. And so like you guys are really kind of like knocking on the door of how Bitcoin, if you're going to go from like Bitcoin incentives, that's what's driving this mission. Like, all right, people should not be getting sick in the first place. Like that is the kind of approach. And I don't know if it exists. I kind of doubt it because I don't see crowd health as this, but like I know there is, at least with life insurance, a Bitcoin-based life insurance with Meanwhile. And so why not a Bitcoin-based health insurance? And I understand getting that ball rolling and the inertia required would be insane.
Yeah.
But once it does, like what's stopping it? Because you have this asset that should, over the long term, continue to go up in value as adoption happens. And people's healthcare would just be getting cheaper over time. And they'd be incentivized to just, as doctors, to just keep them healthy. They're not trying to, treat symptoms. They're trying to treat the underlying cause. Like, hey, what you're eating matters, and things like that.
I love it. You just triggered something in my head. I spend Bitcoin on it. I have no problem spending my corn when I get an opportunity. What I spend it on is what I choose. What is that value I'm going to release my Bitcoin to somebody else, transfer from A to B, right? It better be worth the transfer, the value. I think what the healthcare side is, if you know you're holding, if people actually understand what Bitcoin is, back to your point, and they get it clicked in their head, like, I need to hold this for low time preference for when it really matters, I think that'll drive people also to want to make better life decisions of how they're going to treat their body, right? What am I going to do? So I know I got to spend this at some point on my health when it matters, but do I need to spend it for just I'm just going to go to my doctor because I'm not feeling well. Okay, I got a cold. Do I go to my doctor? Like, I can tell you, my family physician's like, how many people want to come here with a cold? And I'm like, this is a waste of your time and money. And I got other people with cancer right now I can see right now.
Yeah,
So
right.
The reality is, I think Bitcoin for me personally and for my whole family has been, I will think like triple hard before I spend my corn. And if it's attached to something like your health, I think it'll make people decide, what am I going to eat? What am I going to put in my body? How am I going to treat it? And I think that is a big connection piece that is just, there's lack of understanding is real, right? We need to get more people educated on what is Bitcoin, what is the underlying technology, and it's not this scary, invisible thing, right? Once you solve that piece, I think that everything else will fall and will click in, which is why I love the proof of health. Last week when we were in DC,
Yeah.
I have been thinking about that since then, about what if it took a 5-year roadmap journey to go to Congress, which I know everybody, I'm a libertarian, I hate that the government would. But there are some things, I think this is one where we go and get a bill called the proof of health bill. I get Senator McCormick out of Pennsylvania, a Bitcoiner senator, to drive that.
There's a couple of them in Tennessee too.
I'm sure. I'm thinking we get it all going, but
Yeah.
It'll probably take about 5 years. I did the math because I've been to DC many times. It takes about 5 years to do anything.
Yeah.
But I think this is real, and we get the government to say, like, this is what can be allowed to do, and we just drive that. So, it's got feelings, but
Yeah.
I think it's relevant.
That's great.
Yeah.
It's a good Yeah. thought. And I couldn't agree more, because that really speaks to this better experience. People want to be supported in their health journey. There's research to show that when physicians actually take the time to speak to patients about healthier choices, they're more likely to do them. And so if we incentivize that, if we build the system to allow for that, I think we can make it happen. And that's the better experience that pulls people away from the status quo into this parallel system. I don't think, yeah, faster payments or Bitcoin in and of itself, its name is going to do that. It has to be along with what those technologies can allow for with a better experience and the ethos behind it all. And that's that self sovereignty in not only your financial life, but in your health as well, which you've all spoken to.
We did Mark, we were in DC last week. I interviewed Dr. Christian Smith, who's a direct primary care doctor up in Frederick, Maryland. Great conversation. Kyle was in the room. And DPC is now, you can now use direct primary care out of your HSA, which is obviously closely tied to what we're doing at Sound. But we modeled out what a health experience would look like for a patient customer. Okay. So direct primary care can be had for $150 a month, and you can have this relationship with the doctor of your choice. You've got their cell phone. They know it's just like going to your network doctor with Lehigh. But I don't know, has anybody done direct primary care in this room? It's kind of how we used to do it way back in the day when I was a kid, when doctors made house calls. If anybody remembers that, actually, one came to our house when I was very little. It's a long time ago, but it's that type of relationship. And what it does, it allows for the patient to be more invested, but it also allows the physician to be more invested because they're not having to see 800 people in a busy primary care practice because they're incentivized to. They now have a role of maybe 300. And I can tell you, and Dr. Stephany can tell you, like seeing that number of patients is manageable. That's a high quality relationship. And that takes the patient-doctor relationship to another level. So that's one element of it. The other element is what's called a catastrophic plan, which there used to be as well. So you used to pay for healthcare out of pocket. You'd have a catastrophic or a major medical plan. Now we kind of call it the high deductible health plan, where you pay lower premiums, but your out of pocket is higher. But once you hit that threshold, everything after. So if the big emergency hits, by the way, it will if it hasn't, for everybody and their family. That covers like a catastrophic event, so you're not wiped out. Okay. In 2003, the HSA was, when it was instantiated, was coupled and brought in under that process with a high deductible health plan. You have to be contributing to a high deductible health insurance plan. I don't like insurance as a rule, but for catastrophic, it's a nice umbrella. The HSA pairs beautifully with that, and that's our marketplace. And so then you have the HSA, where now you can save in Bitcoin. Again, shameless plug, but any HSA is a good option, whether you use our product or not. You can get an HSA going if you're eligible, and if it's invested in the market or some type of appreciating asset, I don't care what it is. It's a great instrument that has a lot of tax advantages with it as well. But those three, kind of where we're settling, we model those out. That's cheaper than paying a high-priced network PPO over a year for most people in this country. What I just described, those three elements, believe it or not, is cheaper than having just a PPO insurance plan, and very few people really scrub that to look what the costs are.
As part of that pricing transparency, whatever else,
Exactly.
it is hard to make that adjustment. In my family,
Yep.
this is 26, so in late 2024, my wife and I, who've been talking about an HSA for years, finally sat down, and it took us, it was over a period of like 2 to 3 weeks, to dig through old EOBs, to dig through all the old records, to try to figure out if we did this versus that, how would it have turned out? And really the thing for us was not what had happened before. It was, what's the worst case situation? If things go really bad for us from a medical perspective.
Right.
In this scenario, where are we? In this scenario, where are we? And try to balance it all out. And for us, we were able to determine that we would not be any worse off under the HSA. And at that point, we switched.
Yeah.
So that was 2025 was our first HSA year.
Yep.
And now in 2026, we're looking at it going, we're actually a lot better off than we were before.
Yeah.
But this is one of those things of, it was hard for us, and my wife's a PhD economist.
Okay.
I've got the business background, the MBA at UT Austin, all the rest of it. So we're financial people.
Yeah.
And it was painful for us to go through the exercise.
Yeah.
I feel bad for like a regular person trying to figure this stuff out.
Yeah.
It's hard
Yeah.
to make that switch. But to your point, I think for many people, it is advantageous to to make that switch. It's the start of it.
Yeah, you just have to do the homework. You got to go in and do the work and figure it out. Yeah, because I mean, again, it's an open benefits discussion for a lot of people, or open enrollment.
Yeah.
At the end of the year, it's like my employer, if I'm a W-2, whatever, gives me this, and I just
Yeah.
check the boxes, opt in, opt out, whatever, and you're kind of gone. And there's more scrutiny, and that's part of what we're doing too, is educating employers. But now we can bring our product in employer platforms. But I think back to the bigger discussion: how does Bitcoin, come into healthcare and have meaningful change? I think there's a transparent marketplace opportunity. I think there's a wellness and longevity conversation that's not happening. That direct primary care that you can now pay for out of an HSA, but there are a lot of physicians, and Mark, maybe talk to Big VPN, because VPN, Bitcoin Physician Network, I mean, ostensibly could be that provider network from a care standpoint. We're kind of talking about coordination, around health data, but it is likely that you have like-minded physicians that are a part of a coordinated network that potentially could offer patient care, at least in primary care, maybe.
You ever see that trend of the concierge doctors now because they're tired of being taken advantage of?
And that's a great point. Concierge and direct primary care are often interchanged. There are some limits on the amount that you can pay in a year that kind of separate TPC from like a legal or from a IRS standpoint. But yes, they're essentially the same service. You have a direct relationship with your provider.
You know what's interesting? My son had to go this week to get chip his tooth. I know a lot of dentists. We know dental insurance is not real insurance, but I know that it's not just medical physicians.
Right.
There's other practitioners in the medical field. Dentists are ones that is a complicated. I've gone down that rabbit hole.
Yeah.
Like how much more complicated? It's complicated.
Yeah.
And how do you make that system better? So this is like, we need to really focus on what is the lowest hanging fruit for democratizing, and you just go with that first. I think what I love about what Mark did here and start with the Bitcoin Physicians Network is that is going to take some time. But what other are areas of the medical that might be an easy entryway is a great world example, like proof of concept, and democratize it and say, hey, we have now got something to shift into this,
Right.
that people can get behind and connect with. I don't know if it's the dental side. That system's really broken, by the way.
Yeah.
I
Well,
mean,
It's awful.
It's awful. You're overpaying on insurance premiums, and it's obvious, and everybody knows it. But
yes.
but it's a cash pay business. So
It
like
is.
dental, so that's a place where you can really win. There's a physician here. I mentioned it last time. There's a physician here in Nashville, probably more, that accepts Bitcoin for payment. He practices about 2.5 miles from here, from where we're sitting, and he's a friend of the park. But anyway, dental is a great place to start because it is predominantly cash pay.
And actually, the second one to that, I thought it was the first, but the vision side, which is not insurance either.
Yeah.
And most of the retailers own said, like BSP and all
Yeah.
that. That is also another one.
Yeah.
But I actually think that dental is number one, the first entry place.
It affects everybody. Everybody.
Right. I mean, most people don't even go to the dentist that I associate with because they're like, hey, in what world does it make sense to spend $5,000 on
Yeah.
like it doesn't make any sense when I
Right.
go to my medical physician for I get sutures for a couple $100, which you would think that's worse,
Right.
Because of all the time it takes, right? But,
Right. Yeah. I think direct care, whether it's dental or even DPC that accepts cash because they don't accept insurance, are great places to start. I think transparency of pricing, which was a federal law that every hospital was supposed to publish all of their pricing, and most have obfuscated that like painfully. They buried it in their website. I don't even know if most of them even still include it, what their charge master says. But that's the other opportunity. And then with the decentralized health data, or at least a portion of it via Noster, if you're traveling, you're out of the country, what are the use cases where that makes the most sense in applications? But
one last thing, because I know Mark's on here listening, that's why I'm talking as much as I am. But I actually think urgent healthcare, centers,
Meg centers, yeah.
Right. So let's put this in perspective. My IBX, Independence Blue Cross in Philadelphia, Mammoth, it's like second, I think, behind Anthem. It's pretty large.
Right.
I don't even know if it's called Anthem anymore. It would cost me $300 for my insurance to go to urgent care.
Yeah.
But most of the urgent cares in Philadelphia charge around $150 $50 average. It's like just pay cash because
Right.
And you actually and there's like they'll offer the stuff included with that, like your extra. So it's almost like a DPC but for urgency, right? So
Right.
hey, you just got a cut, they're gonna stitch you up.
Yeah.
I think that is another for Mark's side with the Bitcoin Physicians Network. I think those are also another entry besides just DPC.
Right.
So
Yeah.
all these thoughts.
Anywhere a cash pay, a transparent direct pay model could work, I
Right.
think is on the table.
I think it's
Good to
great
see.
that we're having this conversation
Yep.
and exploring it. I think
Yeah.
Kyle's right. The goal is to find what's that low hanging fruit, what's that first
Yeah.
piece.
Yeah.
And I think you're right. I think the direct relationship aspect of it is what lends a lot of it to the Bitcoin leverage in
Yeah.
this case. When you've got that direct relationship, direct pay, that makes it a lot easier.
It's just cleaner. Yeah.
Yeah, it plays to the Bitcoin strength.
Absolutely. Absolutely. Welcome.
Thank you.
My coffee in the house.
Sorry I'm late.
Yeah. No, it's great to see you.
Good to see
From
you, Mike.
Kentucky, it took a little longer to get here than I was anticipating.
All good.
Any other questions or thoughts? I appreciate all this great conversation.
It's been great. Any thoughts from the folks from Alabama at all?
I'm from Wisconsin, but no, I think it sounds great. I mean, I think the Nostr part seems most interesting.
Yeah, you're more technical too, right?
Yeah, I was as a patient, I'm highly involved for other reasons, but I was pharmacy tech for a number of years, so I know the kind of insurance industry pretty well. But yeah, sounds very interesting.
Awesome. Cool. Well, Mark, I think we'll wrap there. We'll probably have some conversation here in the room. Wish you could have been here in person, but man, thanks so much. All good stuff. We recorded this on Riverside, so we'll be able to share some of the clips as well.
Fantastic. Thanks, everyone. Enjoy the rest of your day. All right.